Around the world, the pandemic has highlighted weaknesses in healthcare systems. Patients in rural areas of India have been especially hard hit and poorly served. This week's COVID-19 special looks at how a new initiative wants to change that. Also in the show, Spanish researchers focusing on concepts for dealing with long COVID, while self-help groups foster the development of new therapeutic approaches. But first we go to Uganda, where the pandemic has led to increased poverty and hunger, and the number of malnourished children is rising at an alarming rate.
Davis Turiasingura is severely malnourished. His mother says the trouble started when the one-year-old was unable to breastfeed.
I ran out of breast milk and started feeding my child cassava porridge. Luckily, our cow gave birth around that time, so then I used that milk. Unfortunately, the cow died, and that's when my boy's condition started to deteriorate.
Here at the Fort Portal Hospital in western Uganda, doctors are seeing a rise in cases of severe malnutrition. As a result, a lot of children are not growing properly. Insufficient nourishment at a crucial early age can also lead to impaired mental development and an increased susceptibility to illness. The doctors blame rising poverty in the wake of the COVID-19 pandemic.
And the truth is, if you're poor, then it means you're very unlikely to eat a sufficient amount of food. And then it means you're likely to become malnourished. So out of the 1 million plus of people who are extremely poor, the majority live in developing countries like ours. So with the onset of COVID and the lockdowns and the loss of jobs, the loss of livelihoods, I believe that, more and more people are going to become poor and even severely malnourished.
Beatrice Kugonza used to work as a vendor at a roadside market until the lockdown rendered her out of a job. The single mother now struggles to feed her 4 children.
When I lost my income, the situation with my children got worse. I could no longer afford sugar or soap for my family. And when the kids fell ill, I'd already lost my livelihood.
In the case of nutritionist Bernard Bwambale, the pandemic hampered his efforts to help people in need with crucial advice. During the lockdown, he was unable to visit families. He had to use radio in order to reach local communities and give them tips on which nutrient-rich plants they can grow best.
Many of our households in Toro will produce food, but for market, just to meet other needs of the household. If it comes to the COVID-19 pandemic, people didn't have a lot of things. People were planning to take children back to school and the money wasn't there. So if you have your whole acre of banana or beans or whatever, the priority was, how do I take my children to school? So they sell off everything and take the children to school to meet other costs of living.
According to official figures, stunted growth affects 1 in every 3 children in Uganda. Chronic hunger means that a child is not eating enough of the right kind of food for regular development. The United Nations Children's Fund, UNICEF, says that severely malnourished children are 11 times likelier than their healthy peers to die from common illnesses.
The best way to accelerate it is to ensure that policies are targeted towards the poor through social protection measures that government need to consider and targeted for them to have access to quality diet that they are needed. We also need to make sure that the health system are responsive enough to the nutritional needs. We also need to make sure that the education system is nutrition sensitive.
Aims that do not just apply to Uganda. In a range of countries, the pandemic has worsened food shortages leaving a lot of people suffering from severe acute malnutrition. In Uganda, their proportion of the population is 20% higher than the global average. Beatrice Kugoza's little boy may be in safe hands, those of the doctors, but she remains worried, not just for her youngest child's health, but also that of the entire family back home.
Proper nutrition is also the focus of our next report. More than 3 million people in Colombia have diabetes, but a change in diet and exercise can often help prevent the condition endangering the life of the sufferer.
Isabel Cristiano's life will never be the same. While making breakfast, she has to check each ingredient. She's diabetic and had to spend 25 days in the intensive care unit after catching COVID-19.
They injected me with lots of antibiotics, way too many. It gave me pulmonary fibrosis and 2 blood clots in my legs. I had to learn how to walk again, like a baby.
Long months of recovery followed. Isabel Cristiano took part in a training program organized by the Diabetes Voices Colombia Foundation. She believes the classes changed her life.
The seminars we have taken lifted a veil of darkness. They've been like an engine for us, an engine we needed to get started in order to be reborn.
At the free workshops, patients receive information about the disease, as well as ways to improve their health by changing their eating habits and getting expert advice.
We've already had 15 seminars reaching almost 1,500 Colombian families who live with diabetes, both caregivers and patients. It's a 15-day process. You study 2 hours a night from Monday to Friday.
The workshops fill a void left by the Colombian healthcare system, where consultations with doctors are often too short.
These programs train the patients and their families about the disease, what complications it brings, what the different treatments are, and something that is very important to me, non-pharmacological treatment. We as doctors establish a treatment, for example with insulin injections, but 80% of the treatment is non-pharmacological. Patients have to exercise and follow a nutritional plan at home.
The training brings participants into contact with some well-known people, such as Chef Daniel Riveros, who changed his own habits to avoid going through what his father experienced.
My dad was diagnosed with type 2 diabetes at the age of 47. He passed away about 5 years ago due to complications with the disease. My family had to watch as his body degenerated, which was caused by the disease. For many people, diabetes is only about not eating sugar. And if you don't eat sugar, you're fine. But diabetes is a disease that eats away at the body, little by little.
Daniel Riveros prepares recipes to help both patients and caregivers. They're made with traditional ingredients and are very affordable.
Don't be afraid of diabetes. You don't have to lock yourself away. You can still be active. Many people have diabetes in Colombia and around the world. Through the foundation and their programs, people meet many others in the same situation. They're very supportive. You realize that you're not alone. That's the message I want to get out there.
The chef's story helps inspire participants. Following his advice, Isabel Cristiano was able to lose almost 20 kilos.
And I tell you sincerely, don't be discouraged. You always have to move forward and not lose sight of your love of life.
Isabel Cristiano is walking again. She's recovered completely from her time at the hospital. The training course has taught her that through lived experience of diabetes and COVID-19, life can sometimes give you a second chance.
Do you have questions about COVID-19? Our science correspondent Derek Williams has the answers based on the latest research and analysis. Send an email to covidproducer@dw.com. This week, DW viewer Artyom wanted to know, I just recovered from COVID-19, but now my girlfriend has it. Can I spend time with her? Am I resistant?
First of all, it's important to say that every person's immune system will react in different ways to exposure or to repeated exposure to SARS-CoV-2, influenced by factors like vaccination status, whether you've been infected in the past, with what variants, and how long ago. A lot depends on a key word in your question. When you say, I just had COVID-19, what does just mean? Does it mean last week? Does it mean last month, 6 months ago? No one can tell you how long or how strongly you specifically will be protected from reinfection because no one is really average. But that said, researchers are making general predictions based on what we know about how the immune system works. So let's go over that quickly. When you're infected with SARS-CoV-2, your body soon begins to make huge numbers of antibodies against it. They're Y-shaped proteins that can disarm the virus by latching onto it. They can prevent it from docking onto cells and infecting them. In the background, as your immune system grows acquainted with the specific features of the virus, it starts making what are called T cells, which can detect and destroy infected body cells before they release the next wave of virus. It also makes what are called B cells, which retain a memory of the invader and can start churning out antibodies again quickly during future infections, before the virus can gain a foothold. But the system isn't perfect. It's normal for levels of antibodies in your blood to drop within a few months after an infection. Sure, B cells can make more, but maybe not fast enough to prevent a reinfection entirely. The second issue is the virus has continuously mutated throughout the pandemic. So the longer ago you were infected, the less likely your immune system is to recognize a new variant and react to it effectively. Some of the dominant new Omicron subvariants appear able to slip past immune defenses pretty fast in some people, and reports of reinfections are growing, also in those who were quite recently infected. A lot of experts agree that most people should still be well protected for at least a month or two after an initial infection. But if SARS-CoV-2 is like other human coronaviruses, and there's no reason to think that it's not, then in the long term, variants of it could well be able to infect most of us again at regular intervals.
For many, COVID-19 is not over once the initial infection clears up. The list of possible long COVID symptoms is getting longer, as is the range of treatment options. Ashish Sharma and Alberto Garcia Ortiz have this report from Spain.
Helga Blanca was a successful artist, publishing and illustrating books as well as producing artwork. She was on the verge of setting up her own publishing enterprise when COVID hit back in March 2020. She developed long COVID symptoms, which have devastated her career plans.
Normally I could do this in one morning, but I have been with it like in the table maybe 2 weeks, not be able to work properly. It's very It's very hard. I started bleeding through my mouth, and I started losing balance, and I started falling in one side, and it started to hurt my joints, my muscles. I was not able to walk. And I started also with mental fog. I was very slow. I started to forget things.
Helga's husband, Hector, adapted his lifestyle in order to look after his wife.
I'm just waiting for her to get better. For me, this is the most important thing. If other things is, we cannot travel, we cannot go there, we cannot go shopping, okay, it's not important.
It's estimated that some 15% of all people who caught COVID in Spain have gone on to suffer from long COVID symptoms. Associations have now sprung up across the country, made up of patients. They are joining forces to raise medical awareness of their condition and to help each other with practical as well as emotional support. Maria Angeles is part of an association based in Madrid, which has more than 800 members.
Our objective mainly is to try to get investigation in order to know more about our illness, to ask the organizations, the institution, the public institution, to help us and recognize our illness and give us any social support.
Maria's long COVID symptoms affect her concentration. She has to stop working every 2 hours as she suffers acute headaches and stomach pains. But her physical health was deemed good enough for her to participate in a 3-month study set up by 2 physiologists, brothers Ricardo and Cesar Moreta. Their research focuses on exercising involuntary muscular movement. For example, when throwing a ball, the focus is not on the action of throwing, but how the body automatically creates a posture to support that action.
People with long COVID can have low muscle tone and almost no capacity for involuntary actions. We utilize and work with the language of the body, which means working on the key areas used by the nervous system to speak directly to the muscles. From there, we try and make the muscles work in the most efficient way possible.
Exercises normally focus on voluntary muscular action, but we try to stimulate the part of the nervous system that works with involuntary actions. We're now on the first floor. Most in the class took the elevator because they couldn't manage a flight of stairs. Now, they all walk.
After I try, I see how it was working, and I feel better when I finish the exercise. I think it is because they are the people who is in charge of this. They know better our problem, and they know how to help us.
The Society of General and Family Medical Practitioners is one of 50 institutions currently involved in long COVID research in Spain. Since 2020 and the first wave, some 6 million people were diagnosed and hospitalized with COVID, with a further 22 million people being infected. Francisco José Sáenz Martínez is one of the doctors involved in the research.
We're trying to characterize the types of people who are going to have long COVID symptoms in the hope of treating them beforehand. There are a number of EU studies on this right now. So we'll be able to say that a person has certain characteristics and might develop long COVID, and we can treat them in advance. There's also another research proposal on developing an antivirus treatment. There are a series of retrovirals that have been used effectively for recovery from regular COVID in individual cases. We want to study these people to see if they have a reduced chance of contracting long COVID. This could guide us towards using these retrovirals for any person who has COVID.
What hopes this will bring to someone like Blanca in the future remains to be seen. For now, her focus is on just trying to make her tomorrows a little better than her todays.
I enjoy a lot doing some scarves illustrated by me, like this one.
You did that all by yourself?
Yeah, of course. It was quite satisfying.
In India, a shortage of medical workers has long been a serious issue. The pandemic has underscored just how dire the situation is, especially in rural areas. But an initiative is trying to close the gap by sending medical personnel where they're most needed.
The village of Netawa in Rajasthan is home to about 1,000 people. Pradeepa Sekar is the only doctor here. Sekar moved here from faraway Bangalore, a metropolitan city. She wanted to serve people where it's needed the most. But this is a choice few urban doctors make in India.
Being a only doctor is a privilege that you don't understand until you come to a village. Before coming here, I was regretting even taking up medicine. And I thought, what is the big deal in a doctor? Once I came here, I realized the importance. So it's very, you are really changing somebody's life here. Even one iron tablet is life-saving in a rural setting.
Sekar came to this hospital through an initiative called the Rural Hospital Network, which started in early 2022. The network is the brainchild of a doctor herself, who is keen to fill a deficit that's depriving millions of people of medical help.
In India specifically, it's really sad that 60% of our population is in rural India, but only 30% of our doctors work there. So there's a definite need in rural India right now, not just for doctors, but for healthcare professionals.
What Rural Hospital Network has done is built a database which helps healthcare workers find rural placements. The idea is to bring doctors, nurses, medical assistants to villages like these that otherwise run the danger of becoming medical deserts. This hospital has become an oasis. Sekar and the nurses say they are able to resolve 3/4 of the community's medical problems right here. As we wait, patients file in and out of the hospital all day.
There is no one else around. With a new doctor here, things are a lot better.
They treat us no matter what time of the night or day we come. They never close the door on us.
Every week, Sekar and her team visit nearby villages to check children for signs of malnutrition. They measure their weight and height, keep records of their growth, as well as advise the mothers on how to reduce the kids' addiction to chips and crackers.
We are not focusing on just, how many people we measure, what we say. We really want to see the outcome. We want to actually, care. We want to actually see the children grow up.
And they are growing. The hope is that the number of workers will too, so that the future of rural healthcare in India no longer hangs in the balance.
During the coronavirus pandemic, many children worldwide have been unable to go to school. But for many young people, attending classes is one of the few chances to escape poverty. In Ajegule, one of the poorest neighborhoods in Nigeria's capital, Lagos, a community project is providing new hope.
Many of these children come from families who can't afford to send them to school. They live in Ajegule, a poverty-stricken neighborhood in Lagos. But this free library is a ray of hope for children in the community. Hundreds of them now have access to books and computers thanks to a project initiated by Grace Chinea Inkusha.
In the heat of COVID, we opened this library. It was an office. We had to transform it to a library for children because we realized that these kids were not learning. They were left behind, of course, because of the internet gap and smartphones. Some of the parents do not really have those facilities, and even if they have it, they have to go to work.
You don't see me. The project started out with 10 kids. Now it has about 1,000 library users. For most of them, it's their first time using a computer.
I like coming to the library because I learn how to type with the computer, learn how to play educational game, learn how to read my books, and have so many friends.
Many children living in this community have to work instead of going to school. But the library has become an alternative place to learn for these kids, providing a small but potentially vital chance for a brighter future.
And that's all for this week's edition of the COVID-19 special. Thanks for watching. Stay healthy and see you next time.